Thank you very much and have a good night.
Hello friends, good morning. Hello friends, welcome to this session. I am Dr. Anuradha Dhawan, your ophthalmology educator with Unacademy, and in today's session I welcome you.
Thank you very much and have a good night.
I welcome you to this special session in which we'll be discussing lasers in ophthalmology. Okay. So let's start with the session. So first of all of us, we know laser is an acronym for light amplification by simulated emission of radiation. Hello friends, welcome to this session. I am Dr. Anuradha Dhawan, your ophthalmology educator with Unacademy, and in today's session I welcome you. Okay, so let's start with the discussion. In ophthalmology, different type of lasers are used. First of all, let's see what all type of lasers are used in ophthalmology. The types of laser which are used, I have enumerated here. Okay, so they include your NDYAG laser, frequency doubled NDYAG laser, Excimer laser, Femtosecond laser, diode laser, and argon laser. Now let's see in which indications these different type of lasers are used, what are their peculiarities, and what are the indications in which they are used. Okay, so let's first of all talk about ND-YAG laser. Now ND-YAG laser is a photo-disruptive type of laser. Different lasers, they have got different mechanism of action which make them useful in treating different conditions which we come across in ophthalmology. Photo-disruptive means that at the place this laser will be targeted, it will cause disruption of tissue in that particular area. Okay. The wavelength of this laser is 1064 nanometer, almost near infrared. Okay. So because of the photoreceptive disruptive mechanism of this laser, there are two very important indications for the use of this laser. Okay, so can you see with me this image 1 over here? Okay, here this is an image which is showing you a case which has been treated for after cataract. We know after cataract or posterior capsular opacification is a common complication which develops in the later stages post cataract surgery. Many patients, they start having decreased vision, and the reason is after cataract or development of posterior capsular opacification. Okay, so to clear the vision in these patients, we have to clear the visual axis so that they can regain their vision. And what do we do to clear the visual axis? The procedure is known as capsulotomy. We make an opening in the opacified capsule, which is called capsulotomy, and ND-YAG laser is the one which is used to make this capsulotomy, and the procedure is known as laser capsulotomy or ND-YAG laser capsulotomy. Okay, so we can see here very clearly this is an opacified posterior capsule. The laser is targeted at the posterior capsule, and by its photodisruptive action, it makes an opening inside and clears the visual axis. Okay, the second important use of ND-YAG laser is in the cases of glaucoma in which angle closure is there or pupillary block is there. Again, here the use of photodisruptive mechanism of this laser is taken. Okay, and in this image, in image 2, you can see there is an opening which has been made in the peripheral part of the iris. Okay, this is called peripheral iridotomy. peripheral iridotomy, that is, an opening has been made in the peripheral part. This iridotomy again has been made with the use of NDYAG laser. The laser disrupts the iris tissue in this peripheral area, creates an alternate passage for the aqueous to flow from the posterior chamber to interior chamber, and thus preventing pupillary block in the future, thus preventing the attack of glaucoma in case the pupillary block happens in the future. Okay, so NDYAG lasers, two important indications are your laser capsulotomy for the after cataract and peripheral iridotomy in the cases of angle closure. Okay, moving on to the second type of the laser which is used in case in ophthalmology, very important, and you must be aware of this, Excimer laser. Excimer laser. Now, in comparison to NDYAG laser, which was photodisruptive, Excimer laser is your photoablative laser. Okay, so please concentrate on this. It is a photoablative laser. It ablates the tissue onto which it is applied. Ablation means that it kind of evaporates the tissue to which it is applied, leading on to the decrease in the amount of the thickness of that tissue. Okay, so the use of the Excimer laser is made mostly in the cases of refractive procedure, and a very common one done these days, LASIK. Okay, your laser assisted in situ keratomiliosis, the procedure which is done to correct the refractive error of the patient. Okay, the wavelength of this laser is almost in the ultraviolet range, that is 193 nanometer. Okay, if I talk about the LASIK, so what is the basic steps in the LASIK and how the Excimer laser is used? What we do in LASIK, we create a corneal flap. Okay, a corneal flap is created and everted, and then at the base of the cornea, this Excimer laser is applied. Okay, on the stromal base, the Excimer laser is applied. Where the laser is applied, it ablates the tissue over there. Okay, that accordingly, depending upon how much is the refractive error, the ablation is automatically done, and then after the procedure, you set back the corneal flap. Okay, so this is your LASIK procedure. When the corneal ablation is done without the formation of a corneal flap, then the procedure is called photorefractive keratectomy or PRK. Again, both of these are your refractive procedure in which use of Excimer laser is done. Okay, the third case in which we use the Excimer laser is your PTK. Okay, so what does the T stands from here? Here the indication is therapeutic. Okay, so it is phototherapeutic keratectomy, which is done in the cases of superficial corneal opacity, or if there is superficial corneal degeneration. So those are the cases in which we do the PTK. Okay, so this is your Excimer laser, a photoablative laser, main indications for refractive procedures like LASIK, PRK, and also for phototherapeutic keratectomy. Okay, coming to the third type of the laser which is used in ophthalmology is your femtosecond laser. Okay, femtosecond laser is called so because it has a very high frequency of 10 raised to the power minus 15 seconds. Okay, it is again a photodisruptive laser, but the difference from the NDYAG laser is that it comes as short pulses, very fast short pulses. Okay, the wavelength is near infrared 1053 nanometer. Okay, femtosecond laser finds its use in both refractive procedure and the modern day cataract surgery. Okay, in the refractive procedure, as a part of the LASIK procedure, the formation of the corneal flap can be done with the help of the femtosecond laser. Formation of corneal flap is done with the help of femtosecond laser. Then another latest refractive procedure is your SMILE. What does SMILE stand for? SMILE is your small incision lenticule extraction. Lenticule of what? Cornea. Okay, so it is a refractive procedure. We are extracting a corneal lenticule which has been fashioned by the use of femtosecond laser. This image which is put over here is showing you the steps of the femtosecond laser. In SMILE, what are we doing? Actually, with the help of the laser, a lenticule of the cornea is made within the corneal stroma. Okay, and then by making a small incision, smile-like incision, with the help of the instrument, this lenticule is taken out. That leads to correction of the refractive error. Okay, so smile with the use of femtosecond laser. And another important and latest indication is in the femtolaser assisted cataract surgery. Okay, so we discussed in the previous session also that now 3 basic steps in cataract surgery are being performed with the help of femtosecond laser. What are those steps? Okay, we are able to create corneal incisions with the help of the femtosecond laser. We are creating CCC, continuous curvilinear capsulorhexis, with the help of the laser, and we are also able to chop the lens or break the nucleus into the smaller fragments with the help of the femtosecond laser. So this helps us in femtosecond laser assisted cataract surgery, also known as in short FLACS. Okay, now after these interior segment indications in which these lasers are used, let's study about the lasers which are used in the retinal diseases. Okay, so there are many retinal conditions in which we do laser treatment, and the lasers which are available with us, the 3 main type of the lasers are your frequency doubled NDYAG laser. Okay, when you double the frequency of the NDYAG laser, the wavelength becomes half. So it is wavelength is 532 nanometer. Okay, the second is your diode laser, which has a wavelength of 810 nanometer, and argon, to lesser extent, argon green 532 laser is used. Okay, the main mechanism of action of the lasers which are used in retinal diseases is photocoagulation, and the diode laser being of longer wavelength causes thermal effect also. So added effect of thermal therapy, or what is known as thermotherapy, along with the photocoagulative action. Okay, so what are the indications in which we are using the lasers in case of retinal diseases? Okay, very importantly, proliferative diabetic retinopathy. Proliferative stage of diabetic retinopathy requires pan-retinal photocoagulation laser. Okay, then for diabetic macular edema, which is not diffuse, which is focal. Okay, various other vasoproliferative diseases, for example, as a complication of retinal vein occlusions, sickle cell retinopathy. Okay, in the cases of vasculitis like Eales disease, etc. So any vasoproliferative disease in which there is neovascularization, the laser photocoagulation is used. Okay, for the treatment of retinopathy of prematurity. Okay, if there is development of retinal breaks or tears, we create a chorioretinal adhesion around that tear with the help of the photocoagulative laser. And last but not the least, for the focal treatment of small intraocular tumors. Okay, so let me just introduce you that what are the different indications. This image is showing to you how the laser is applied in the case of diabetic retinopathy. Okay, so this first image is of, as you can see here, the laser has been applied in focal areas. So this is your focal laser, which is done to ablate the leaking microaneurysms in the case of clinically significant macular edema focal type. Okay, second image is showing you again the laser in the macular area, but it is applied in a grid like fashion. Okay, so this is your grid laser. This is again done for the CSME, clinically significant macular edema. The third picture is of pan-retinal photocoagulation. So you see here the laser is applied in all the quadrants of the retina, pan-retinal, sparing the macular area. The indication is PDR or neovascularization elsewhere or at the disc. Okay, so looking at the real-time picture, this is the fundus picture, and you can see this is the clinical image, how the laser marks are applied in a case of proliferative diabetic retinopathy. This is your pan-retinal photocoagulation. So what does the laser do? Laser actually decreases the oxygen demand of the ischemic retina or hypoxic retina by converting this tissue into an anoxic tissue, and which in turn also leads to decrease in the levels of VEGF, vascular endothelial growth factor. So that helps in regression of the neovascularization. Okay, the picture to your right is showing you how the laser is done around a retinal break in the case of, now this is a case of horseshoe tear. As you know, the horseshoe tear is one of the major risk factor for the development of rhegmatogenous retinal detachment. By applying the laser marks closely around a tear or a retinal break, we create a chorioretinal adhesion so that development of retinal detachment is prevented in the future. Okay. Now here what we are looking at a fundus image in a case of retinopathy of prematurity, and you can see the laser ablation of the avascular retina is done. Okay, so photocoagulative laser is used for the treatment of retinopathy of prematurity. And another important indication, as I told you, is the focal treatment of intraocular tumors. Retinoblastoma, this is showing you the focal treatment with the help of diode laser. It causes thermotherapy photocoagulative effect and leads to the shrinking of the tumor. Okay, similarly, even for small choroidal hemangiomas, again thermotherapy with the diode laser can be done. Okay, so with this I have summarized the different type of the lasers which we use in the anterior segment and posterior segment. For the anterior segment, we are using NDYAG laser for capsulotomy and iridotomy. We are using Excimer laser for the refractive procedures like LASIK, PRK, and as well as in phototherapeutic keratectomy. We are using Femtosecond laser in the refractive surgery like SMILE, as well as in assisting cataract surgery, that is Femtosecond assisted laser cataract surgery. In posterior segment, mainly we are using frequency double NDYAG laser and diode laser, and the various indications, they include diabetic retinopathy, macular edema, vasoproliferative disorders, retinopathy of prematurity, as well as the focal treatment of the small intraocular tumors. Okay, so with this I thank you for attending this session, and please stay tuned for upcoming YouTube sessions in which we'll be discussing more topics. Okay, Dr. Anuradha Dhawan here, wishing you all the best and best of learning. Thank you very much.